All right, well, welcome everyone. Thank you so much for joining the May Behavioral Health Advisory Group. I hope everyone is having a great start to their month. And to get us started today, if anyone would like to introduce themselves, we have a mindful minute prompt in honor of Mental Health Awareness Month. If you'd like to share your name, organization, and a mental health advocate or champion who inspires your work. And I can go first. For those who I have not yet met, my name is Taylor Palmer, and I'm with the Prince George's County Health Department. And I am inspired by all of you, especially this month and always. So thank you all for all of your hard work, and thank you for continuing to show up. All right. Anyone else who would like to introduce themselves today or pop your advocate in the chat? All right. Well, we will go ahead and get into our agenda. So first, we have a presentation this afternoon, peer recovery mapping project from one of the most highly esteemed Prince George's County Health Department interns, Carolyn. And then from Dr. Wiggum, we have a presentation on peer support training curriculum. We will open it up to the group for some open Q&A. We will go over some community announcements and upcoming meetings, and then we will adjourn for the afternoon. So first, I just want to give time. I don't know if Carolyn was able to join us. I know she's on a work trip and was having some Wi-Fi issues. Carolyn, are you on the call by any chance? Okay, I'm going to take that as a no. But one of our presenters today, Carolyn Fromer she was with the Prince George's County Health Department this semester. She is a second year MPH student at the University of Maryland, College Park, studying epidemiology. She's currently working for the FDA and has a passion for women's health, crisis intervention, and people experiencing power-based violence, and her infectious disease research looks at the impacts on women in the global South. So really great to have her presentation. We have a recorded presentation from her today, so I will go ahead and share that.
Hi everyone. So I guess if you're seeing this, it means I couldn't make it to the meeting with you all today. I have I have a work retreat and it is kind of in the middle of nowhere, which I wasn't expecting, and the Wi-Fi is pretty spotty. So if you're seeing this, it didn't work out to come in on live, but I'm happy and excited to be able to share this information with you, even if it is pre-recorded. So my name is Carolyn Fromer. I was an intern at the Prince George's County Health Department, specifically at the Bridge Center. And my kind of my project of the semester was looking at the peer recovery network in Prince George's County. So kind of understanding the support infrastructure that already exists and collecting data on that so that we can better utilize it in the future. Let's see. So I kind of want to start off by emphasizing the vital role that people with lived experience have in both the recovery process for substance use disorder, the support for mental health disorders, and then also kind of what I focused on the most, support in the reentry process. So in 2019, Prince George's County had a 21.6% 3-year recidivism rate. And then when you compare looking at the Bridge Center clientele and their recidivism rate, it was less than 1%. So obviously we're comparing a 1-year recidivism rate to a 3-year recidivism rate, but still you just can see that huge difference. And just further proof of the important work that everyone at the Bridge Center is doing, but specifically people who are the peer recovery support specialists. And then, so there's also a lot of literature, both qualitative and quantitative, looking at the impacts of being in a peer support program. It's associated with decreased recidivism, as we see in Prince George's County, but also increased documentation. So something as simple as getting a photo ID is really hard. I didn't know that before coming into this internship. And if you're coming out of being in prison for 50 years, that's hard to get something like that. So working with peers is associated with more ID attainment, which means more access to resources, also more access to housing, employment, transportation, and then the big one is substance use disorder and mental health support, and I guess go along with that reentry support. And then kind of the last point is also just citing another our peer-reviewed article that found that peer recovery specialists had, a population that had half the recidivism rate compared to the general population. In Prince George's County, it's even better. So kind of to talk a little bit about what I did this semester. So I started off by interviewing the peers that worked at Prince George's Health Department, both at the Bridge Center and at Cheverly. The people at Cheverly do more substance use disorder. And so based on those interviews, I kind of came up with the interview questions that they thought were most applicable, and what I kind of gained from my conversations with them. And then from there, I kind of use their expertise to understand where peers are likely located, specifically what organizations might house peers. So through that, I came up with a list of 40 organizations who might have peers, and I got 21 responses. And then I connected the data that I got from those responses to census data, to American Community Survey data, I think the 2018 version, looking at the smart location database. And then a lot of the mapping I did required shapefiles. So I'm also citing that sort of data source. So from my data collection, I found that there were 49 peers working in the county at 10 organizations, 45% of whom report being paid for their role. So to kind of go into that further, on the left is just a simple map of Prince George's County with the locations of the organizations that house peers. And as you can see, they are pretty concentrated around DC, and a lot of kind of the more rural areas don't have as many organizations. Another data point that's on this slide is 35% reported certification, so being certified with the state of Maryland. But kind of an addendum, like a important note, is that if I excluded the data of people who didn't know if the peers at the organization were certified, 71% were certified, or at least working towards certification. And it was a combination of in-person and remote services offered by pretty much all organizations. So just to kind of look a little bit more about how the organizations are spread out in the county, this is a population density map I made. I just kind of looked at, it was EPA data looking at the number of people per census tract, and then I divided that by the area of each census tract just to get like a simple measurement. And so the darker blues are more densely populated and the lighter blues are less densely populated. And the organizations are pretty, follow the dense population part pretty well. But there are certainly still people in the rural parts, especially in the on the more eastern side towards Charles County, that are still there and need services and maybe don't have as much access. Something I learned while I was at the Bridge Center was things that I kept hearing about were housing, and then also transportation, and like metro cars being kind of a great incentive to get to get people to come to groups or to services, because transportation is an issue, and a lot of people don't have a car, especially when you're coming right out of prison. And so I looked at the National Walking Index, which is it's a bit of a misnomer. It certainly looks at things like sidewalks and, miles to the nearest supermarket and all those kinds of things, but it also looks at just general public transportation. So how far is the walk from a metro stop to a workplace? Um, that kind of thing. So it takes into account certainly walkability, but also even if there is a metro, how frequent are those metro stops? How close together are they? That kind of thing. And so it's a national index that goes from 0 to 20. Here, I guess the lowest we have is 2.5 and the highest we have is 19.17. But when I weighted it based on population density, the average walkability index of Prince George's County was 12, which is okay. I don't know, kind of right in the middle. But as you can see, that is highly weighted based on if you're near DC, you have much more access to transportation and also just being able to walk compared to the rural parts. So again, pointing to a real need in more rural parts of the county that are farther from DC, who might not be able to get to some of the organizations located as gray dots on this map. So based on this information, something I think that would be a good idea is to publish a list of organizations to reach out to, both for clients, but also potential peers. So something I want to kind of bring your attention back to is I reached out to 40 organizations and I only heard back from 21. And it's not like I heard back from the 21 on the first time I reached out. It took a lot of calling and it was kind of even hard to know where to look for organizations. So if someone who is in the system and has these experts to ask about what organizations, has a hard time finding them, I'm sure that people who are in their recovery journey or just re-entering society are going to have an even harder time. So kind of consolidating that list, and the current list on the website, under behavioral health division has I think like 3 organizations, and the only one that is still active is Employ Prince George's, which is great, but I think there's also a lot of other resources that I think should be highlighted more. And then also only 45% of peers are paid for their work, but a lot of the organizations I talked to, who were paying their peers said they had more room, for more peers. So if peers are looking for hours and want to be paid to get those hours, I think having a better network of people who already have grant money to pay peers, is a great idea. So this is kind of just a quick list of where I'm getting the 49 number. So the peers, is the name of the organization and then the number of peers at that organization. So just there it is. And thank you so much. I'm so sorry again to not be able to be there in person. I'm bummed, and it sounds like you all have so much knowledge and I would have loved to be there, but I'm happy I was able to share what I learned this semester. And thank you very much to Nina and Dr. Wiggum and everyone at the Bridge Center. It really was a great experience. And if you have any questions, especially because I'm not there, please don't hesitate to reach out. I put my work email just because if it goes to my work email, I'm for sure gonna answer. But also if you want to give me a call or a text, no problem there as well. That's my number. Yeah, and please don't hesitate to reach out. I'd be happy to chat more at a later date. So I hope you all have a great rest of your day. Have a good one. Bye.
Sending virtual kudos to Carolyn for that wonderful presentation. Are there any initial reactions? I know Carolyn's not with us, but any questions? I know we have Dr. Wiggum here. I don't know if you're able to answer any of the questions of what Carolyn went over, or would anyone like to go back to any of those maps that were shown? And Jay, I see your question here in the chat. I can certainly get Carolyn's permission to be able to share.
That would be really helpful. There's through the homeless services, there is an organization that's doing peer development, and they have a lot of overlap with the peer recovery community. And I'm sure they're sort of a regional organization. The director of the National Coalition for the Homeless in DC was one of the people that's spearheading that for us. So I'm sure that this would be incredibly useful information for them to know about sort of the overlap. And this was a great sort of needs analysis. So I know it would be very helpful. I know that these meetings are recorded. I just couldn't remember whether they were then shareable outside of the BHAG. So
Yeah, absolutely. Feel free to share the meeting recording and I'll follow up with Carolyn and I'll get you those slides.
great, thanks.
Thank you.
I also found it really interesting. And hi, everyone. I'm Kim Stinchcomb. I'm with the Health Department, Office of Assessment and Planning. I found it really interesting that as we're going through all of these different areas, and some of you might be also participants in the community care coordination team, something we're working on is addressing access to care and working with our partners who are identifying resources and ways to connect people with resources better. And I know we'll have actually a plug for this later in the presentation, but next week we'll have a representative from Find Help coming to our meeting to discuss their platform and ways to connect people with community-based organizations and resources and just expanding that work. So it would be interesting to see if some of the centers that were identified in Carolyn's presentation are already in Find Help. And if they're not, how can we make sure that they are represented so that people have better access to those resources? So I think this was great. And yes, congratulations, Carolyn, if she watches this later.
And we breezed into this presentation. Carlos, I know you had a few words on the topic and the importance of this discussion. I don't know if you still wanted to share anything.
Yeah, Taylor, I think moreover for me is, peers in the workspace for behavioral health and substance use has just been so important, when you think about the service delivery, the effectiveness, the experience that individuals, facing mental health and substance use challenges experience. And, I always think of, in my experience working in the field, it's a lot uh it's a lot better for someone to be looking down at someone who's decompensated at their worst point, going through a challenge and saying, you know what, I know what it's like to be there. I've been there before. Here are some of the things that I did. Here are some of the resources that I learned about, some of the places that I went to. This is what worked for me. It may not work for you, but this gives you some options. In addition to, here is how I navigated through the system. This is some of the insurances that may work. These are some of the fee waivers. This is how you get into programs, that type of thing. And then even more, just to have that ear that's listening to you, that knows exactly what you've been through, is just so important. So peers in the workspace, when you talk about behavioral health and mental health, substance use is huge.
Thank you for that, Carlos. And planning this meeting, I realized how many misconceptions I have about the peer network and how all these processes work in Prince George's County. So really excited to see Carolyn's presentation and then what Dr. Wiggum's going to be presenting on to learn more about the certification process and understanding how that all stands. So any other comments before we jump into Dr. Wiggum's presentation? All right. Well, next we will jump in. Thank you so much, Dr. Wiggum, for joining us this afternoon. Dr. Wiggum, um, just jumping down to the second paragraph, that 24 years really sticks out to me. Her services spanned 24 years with the Prince George's County Health Department. She began her career at the health department as a part-time counselor in a women's intensive outpatient substance abuse treatment program and progressed through the ranks to program management. Her current portfolio includes management of adult reentry, community reentry, offender reentry, and reentry support programs, along with the Bridge Center at Adams House and Child Support Liaison and the Langley Park Multi-Service Center. Thank you so much for being with us here today, Dr. Wiggum. Really excited to hear your presentation. And let me advance to your next slide here.
So good afternoon, everyone. It's always a pleasure, and thank you for the invite. I'm just going to go ahead and get started. One thing that I loved about Carolyn's presentation is the emphasis on the need for more peers, more certified peers in the county. So you can, next slide. So in order to become a certified peer support specialist in Maryland, the person needs to have a high school diploma or a GED, be 18 years of age or older, and reside in the state of Maryland at least 51% of the time. The person must identify as a person who's been in long-term recovery from either a mental health disorder or a substance use disorder, for at least a period of 2 years. And then, of course, they have to complete the course of training, a course of training that is certified by the Maryland Addiction and Behavioral Health Professionals Certification Board. And so what the health department, because of our need for certified peers, we developed a curriculum because we wanted something that was more locally appropriate for Prince George's County residents, that really focus on the needs, especially the reentry population needs. And then we also wanted it to be available to our residents at free of charge. There are a number of training programs for peers, but they can get relatively costly. And then also, as I mentioned, my programs primarily serve returning citizens. So we were really looking to involve returning citizens in the peer specialist spectrum. Next slide. So this curriculum is for any organization that is serving ex-offenders or returning citizens, for any persons that are interested in becoming peer support specialists. And so we emphasize to them that they do need a minimum of 1 year experience providing peer support, or have that lived experience with the criminal justice system. And then it can be for professionals who are currently peers but don't have the training, or they don't, or they are seeking to get the certification. The curriculum is based on practical knowledge and skills, as well as the philosophy and psychology that underlies peer support. The curriculum, it gives the participants the opportunity to practice their skills, and it especially hones in on supporting individuals that are criminally justice involved, or have mental health and or substance use and or medical diagnosis. We do have some participants who are survivors of cancers and other illnesses that relate and make sense for peer support. So the development process, I'll just stop and mention that we had a consultant, Dr. Lorene Thomas, which I'm sure some of you are familiar with. She does a lot of work with the health department. She is the evaluator for my offender reentry program and the adult reentry program. And so her consulting agency undertook the curriculum development process. They started by looking at the requirements, the board requirements, and then they proceeded to do a literature review, develop a curriculum outline, and then they pilot tested it with a number of peers in I know that it wasn't just in Prince George's County, but I would say in the Washington, D.C. metropolitan area. So they pilot tested, and then once they created the curriculum, it was reviewed and approved by the Maryland Addiction and Behavioral Health Professionals Certification Board. So the training objectives are to deliver a training that adheres to the professional code of ethics and core values for peer support workers, to teach our peers how to advocate effectively for their clients, to teach our peers how to serve as compassionate mentors and informed educators to their clients, and to teach them how to assist their clients as they progress towards wellness and recovery. And there are 4 core modules which meet with the requirements, the domain requirements by the board. Each module has its own text. It is based on discussions, and there are plenty of videos. We do role plays and other types of exercises. And each module includes a glossary, resources, and action plan templates that the participants can use. We call it put in their toolbox, and each module has a quiz and a bibliography. So as I said, there are 4 modules, and the first module is ethics. The board requires 16 hours of ethics, and so we cover those 16 hours over a course of 3 days. And the contents include boundaries, healthy and unhealthy boundaries. We look at the code of ethics, the board's code of ethics. We delve into values, especially those that are established by the National Association of Peer Supporters. We have a number of videos from SAMHSA on ethics, as well as we review and discuss 18 ethical scenarios. And then, of course, we have a toolkit for everyone. We go over the 42 CFR Part 2, which is on confidentiality for substance use disordered clients. We have a coaching intimacy continuum tool that for recovery. And we also look at the steps to resolving an ethical issue and how to issue a complaint to the board. Module 2 is advocacy. It's a 10-hour course, and it is covered over a 2-day period. So we look at how the National Association peer specialist core values relate to advocacy. We look at the challenges that peers face as professionals. We do an overview of the criminal justice system and the behavioral health system. We look at the challenges that returning citizens face, which are numerous, and how the peer specialists can help the returning citizen address those challenges. We do reentry planning. We delve into the sequential intercepts model. We look at returning citizens' rights, anywhere from what their rights are around voting to housing and whatever. It's almost, there's so many categories, healthcare, looking at all those rights and how to advocate for those rights. And then we look at how to help a returning citizen complete community supervision and tips on pre-release planning, and then the tools for and resources for the toolkit. Third module is wellness and recovery. Again, this one is 10 hours as well, which is covered in 2 days. And so as you can see, there are a number of topics that we cover: the wellness dimensions, how substance abuse and chronic pain and trauma impact wellness. We look at SAMHSA's 10 recovery principles, how to develop resilience. We cover mental health first aid. We spend a lot of time discussing trauma and trauma-informed care. We cover harm reduction, medication-assisted therapy. We look at cultural and linguistic competence. And then we also work through a RAP plan. And module 4, mentoring and education, 10 hours covered over 2 days. And so we spend a lot of time talking about the importance of self-care and self-advocacy for peers, and how they need to maintain what they need to do to maintain their recovery, physical health, emotional health, psychological health, spiritual health. And also we talk a lot about safety, especially when you're going out to meet clients in the field. We look at obstacles that clients might face on the path to recovery, but also recovery for our peers, what that looks like, and the importance of self-care, and what to do if you have a setback or relapse. And we also talk about how to find help for yourself. And then we talk about telling your story. And we delve into motivational interviewing and conflict resolution and problem solving. And our last, we include in our last session how to run a peer support group. Our future considerations, things that we're looking at right now, is starting a peer volunteer program. And one reason why we want to do that is that part of becoming certified is that you have to complete 500 hours of work experience or volunteer experience. And we would like to have some more volunteers at the health department. I think that if you might have seen it, noticed it in Carolyn's presentation, they have 4 certified peers at Cheverly, and we have 3 here at the Bridge Center. And truly, there is more need than we have the peers at our location. So we're looking at a volunteer program, not only to help us, but also if there are community-based providers who need peers and can take on peers to help them with their volunteer hours, that would be great. Another piece to that is that we need a registered peer supervisor, because also part of the certification process is 25 hours of supervised 25 supervised hours in the domains of the training, which are ethics and advocacy, wellness and recovery, and education and mentoring. So we're looking to hire a registered peer who can oversee the volunteer program, make sure that that anyone who is training as a peer gets the supervision that they need, that the board will recognize. And that is pretty much all I have to say. And if you have questions, I will try to answer them as best I can, but that's how you can contact me. And I do respond to my email messages.
Thank you, Dr. Wiggum. That was wonderful. Thank you for presenting on that curriculum. A question for you regarding the volunteer program. I know something that Carolyn mentioned, a barrier may be those 500 unpaid hours. Do you know of any opportunities, or would there ever be the opportunity within the volunteer program for some of those hours to be paid, or is it a rule that they have to be unpaid?
No, they can be paid hours. We had actually, and I don't know if I should mention this or not, but I can get my hands smacked later. We had actually pursued a grant, hoping that we could get monies to provide stipends to volunteers, and it didn't work out in our favor. But we're still looking. And then for some provider, well, actually, in the state of Maryland now, behavioral health providers can bill um, for peer hours. So if we can convince some of our behavioral health providers to utilize that ability, that could possibly be taking on a peer and being able to pay them.
Thank you. And Carlos, I see you have your hand raised.
Sure. Thanks, Taylor, and Dr. Wiggum. Thank you so much for this great presentation. And I just wanted to ask you if you can kind of speak on the climate of, we understand how important peers are to this profession. We have the statistics to prove, the effectiveness. And I'm just, speaking on, how you're looking for volunteers, and funding continues to be a challenge. What is the advocacy looking like as peers are starting to be respected more as professionals in an intricate part of the behavioral health and substance use space? And how is that looking as we look to increase their wages and recognize them as the partners that they are to this space?
Uh, I think we are moving in a positive direction. I think that I think basically we just need to do more. Um, I would say more advocacy in spaces where there are people who make in where their decisions are made. We let's see, that it's a to me a kind of a complicated question, because we're working hard at the Bridge Center and in the health department to help our partners and and our network become more aware that peers are available, and we're trying to train peers so that they can be effective in the work that they do. So I just think that we just have to keep at it, because there is an important and viable place for them in the workplace. And I
Mhm.
probably didn't answer your question.
No,
Carlos, this is
sure.
Denise. I can chime in if you don't mind. I think Dr. Wiggum, you're right on target. You mentioned the Behavioral Health Modernization Act that the state of Maryland passed. So with that, it's got to come regulations, billing codes, description of the service, right? I mean, all of that is in the regulation, but then reimbursement, right, rates and all of that good stuff for it to be more widespread widespread and readily available within the public behavioral health system, or just in our net behavioral health and substance use world in general, because it will be a reimbursable service, hence open the door for peers, like you said, to be paid, right? Because now that it's billable, there is a lane for our providers to be able to identify like salary, wages, benefits and all of that package for our peers, because it is a respected profession, and it's
Mhm.
they have a place, right, to
That's right.
support people where some of the trained clinicians can't reach some of our clients. They have the ability to do that and do it well. So no, I think on that macro level, the federal government recognize it, CMS recognize it, in other jurisdictions, other states. This is a billable service, and states are well advanced and well ahead of us in terms of doing this already. But like Dr. Wiggum said, the state is moving in the right direction. Now it's going to be billable, and similar to telehealth, where the uptick and the where people, it was there, it was a billable service, but people didn't pick it up. But then the pandemic kind of pushed us to using it now.
Mm-hmm.
I imagine that over time we're going to see a uptick of this. Once people see it's billable, it's viable, and if the rate is good and it's something that they can lucratively bill and get reimbursed for, and then pay peers according to their what they deserve, I think we're going to see more utilization in this in the state and in other jurisdictions within the state.
That's great. That's great. And I loved everything about that. And Dr. Wiggins, thanks for yours too, because, as you mentioned, they are doing a lot of the heavy lifting, and, they're showing by improving outcomes. So, the fact
Absolutely.
that, yep. So the fact that things are moving in that great direction, and progress has been made. 5 to 6 years ago, I could remember peers were getting, 12, $13 an hour, whereas though now I'm seeing 18, 20, 21. So progress is being made. So thanks, Denise, for that comprehensive response, because that was very helpful for me.
And I'm thanking you also, Denise. I didn't know you were there.
You're welcome.
And I just wanted somewhat piggyback on what Carlos was saying. I find that our peers here at the health department are invaluable. And I work, directly with three of them every day. And our team, our clinical team, works with them, and they are tremendous in helping our clients buy into the services that they need.
And Dr. Wiggum, on the topic of improving this workforce, how can the BHAG support the certification process and keep these processes moving? I know you mentioned taking on the role as a peer recovery supervisor. Are there any ways the individuals on this call can be of assistance to that
If
process?
um, I know that, right, and I believe it's the position is open through the state. It's a contractual position through the state that we are seeking a registered peer supervisor for Prince George's County Health Department. So if you know someone who is a registered peer supervisor, apparently in the state of Maryland, they're very hard to find. But if you know someone who has that credential and is seeking employment, you can point them in my direction, and I'll help them get to the state application for it.
Wonderful. Any other questions for Dr. Wiggum, or any other broad questions about the peer recovery workforce and some of those processes that were discussed today and how we can improve it?
Taylor, if I may, I just wanted to share that, what Dr. Wiggum shared is heavily in the reentry space in terms of our curriculum, but in terms of other future, vision for this training curriculum, we envision it as a division in behavioral health at the health department, is that, in the future, we will have um, multiple modalities, if you will, within that training curriculum. So we'll have like a youth focus curriculum for peers, right? So we can build up the capacity and the competency for youth peers, also for family members who are supporting adults, young people who have behavioral health needs or challenges. So in the family space, we can also, tailor our curriculum to be able to support family, youth. So we have other editions to come, more to come, in future editions or iterations of what we have. But we're starting right now with the corrections or juvenile reentry space with our peer program. But in the future, we anticipate that we'll have future modalities to address other populations.
Thank you for that, Denise. Love to see the continuum of care just continuing to expand. Any other questions or comments? Well, we have both contact information for Carolyn and Dr. Wiggum if anyone would like to follow up, but virtually sending kudos to Carolyn for her presentation, and thank you, Dr. Wiggum, for taking time out of your very busy day to come and present this to us. We are very appreciative of your time. Great. All right, well, we will go ahead and jump into our community announcements. So coming up this weekend, if you'd believe it's already May 18th, is the greatest of all time mental health expo at Bowie State University. Here is the registration link, and we can be sure to put that in the chat as well. I know I will be in attendance, so certainly hope to see some familiar faces. And next, as Kim mentioned, we have the Community Care Coordination Team meeting coming up. That is another one of the Healthcare Action Coalition's work groups. We'll have a presentation from Find Help, and this may be an interesting question to talk about these resources that were discussed today during Carolyn's presentation, and how we can continue to be able to access a list of resources and have that be more easily accessible across the county. So we can put the meeting link here in the chat. That will be next Thursday, May 23rd at 11 a.m. So all of those who are in favor of morning meetings, this is your chance to get to enjoy a morning meeting rather than a later afternoon. And next, to give a little bit of a spoiler, we will be canceling our June BHAG meeting in observation of Juneteenth. So we wanted to be sure to share some resources with you all going on around Prince George's County. So here is Bowie's third annual Juneteenth Festival taking place on Saturday, June 15th from 11 a.m. to 5 p.m. And then also on that same day, hosted by the Prince George's County Parks and Recreation. Their event is also taking place on Saturday, June 15th from 12 to 5 p.m. This should be a wonderful outdoor celebration. Next, this is an ongoing opportunity every Monday from 11:30 a.m. to 12:30, virtual open studio hosted by the George Washington Art Therapy Clinic. This is accessible via Zoom. So this is ongoing, and they have a lot of great events coming up over the summer that can be accessed via the link here in the chat that will take you to a calendar of all of their events coming up. And I will open the floor for any community announcements. As I mentioned, we are going to cancel the June meeting in observation of Juneteenth. We are also canceling the July meeting to give you all a summer break. So I will be sure to send out those calendar reminders. But since we will not see you until August, does anyone have any updates that they would like to share for over the summer that they know of right now? We'll also put the link in the chat to be able to include your events on the Prince George's County Healthcare Action Coalition calendar moving forward, so everyone can stay updated on the events even when we are not meeting.
Hey, Taylor, I see you have it up here. I just wanted to give an additional plug for the Prince George's Healthcare Action Coalition quarterly meeting. We're going to be meeting in person. It's always great to have everybody on site. We'll be at the Parks and Recreation Administration building on Kenilworth, and it's going to be open discussion around data needs and just getting a better grasp on how the community is in, or how the health department and all of our partners are engaged with the community as a whole. So we would love to have you there. Dinner is always provided, so you can fill out the registration link attached, and we would love to see you.
Thank you, Kim. Any other community announcements?
This is Kelly with Clarent, and it's NAMI of Prince George's County and the QIO partnered for their 3-part series on substance use disorder and mental illness. The second one is how to influence compliance, and it is May the 23rd from noon to 12:30. I know that you all had shared the flyer before. I don't know if you need me to send you a new flyer, or if you just want to resend the one for the second one.
Kelly, if you wouldn't mind resending that, that would be helpful.
Okay, I can do that.
And Carlos, I saw your hand earlier.
No, Taylor, I think that was from earlier. I'm good.
Okay.
Mm-hmm.
All right. Well, we will see you all back Wednesday, August 21st. Have a wonderful, safe, and happy summer. Thank you all for all of your hard work that you've done to get us to this mid-year point. Take a much needed break. You have all earned it. And certainly continue to add any events that you have coming up on that calendar. And go ahead, Kim.
I was trying to clap and accidentally raise my hand. So great job, everyone. And thank you, Taylor.
Thank you. All right. Well, take care, everyone.
Thank you. Have a great day.
Bye now.